Swimming and water sports in general are a very important part of Australian life, and people with epilepsy should be able to enjoy that, providing they can do it safely. People with epilepsy and their families need to take the normal precautions around water, as everyone needs to do, but there may be some special circumstances for people with epilepsy depending on their individual case that needs to be discussed with their doctors and health advisors. Before one decides to get into the water, one needs to consider a number of things. First of all, where and what is the water? Is it a swimming pool? Is it ocean? Is it surf? And there will be different levels of risk for that, whether you've got epilepsy or not. When you do have epilepsy, it's important to consider how active it is. Obviously, if somebody's not had a seizure for many, many years, is well controlled and on medication, their risk approaches that of somebody without epilepsy. On the other hand, if they're having very frequent seizures, then there is significant risk and appropriate precautions need to be put in place. To reduce the risk of seizures when they're swimming, they should take their medication. They should avoid the things that normally can provoke seizures, such as sleep deprivation particularly, and for the adolescents and adults, particularly alcohol. As we know, alcohol and partying and water are unfortunately a potentially bad mix. And if epilepsy is thrown into that, it can make the situation even more hazardous. So for school swimming programs, obviously the first thing is to tell the school and make sure that the swimming instructors at the pool know the child has epilepsy. If the epilepsy is reasonably active, then there needs to be one-to-one supervision of the child. As we know, when something goes wrong in a swimming pool, the person can disappear from view very quickly and tragedy can very quickly ensue. Thus, there needs to be one-to-one supervision in the water if the epilepsy is active. It's not adequate to sit by the side of the pool and possibly be on your phone. That is a situation that could result in tragedy. However, if the child is well without seizures for years, then the balance between overprotection and safety need to be considered on an individual basis. Well, one should try to get the person out of the water as soon as possible, and that obviously depends on the situation. Hopefully it's in a situation where the attendee can actually stand and be safe, or if they're a very good swimmer, to tread water. They should tip the subject's head back to keep the water out of the mouth, ideally from behind, and try to get them out of the water as soon as possible, using help if needed. Once out of the water, the normal first aid should be applied. Get the patient away from anything dangerous, lie them on their side, and make sure their airway is clear. Do not put your fingers or anything else into their mouth, and hopefully the seizure will stop spontaneously. So an ambulance should be called if the seizure does not stop spontaneously, certainly after 5 minutes. It should also be called if the person appears to be injured or if there's concern that they may have inhaled some water. Be sensible, be safe, go with somebody who knows your condition.